In India, as of today, there are more than 4,500 positive confirmed cases of COVID-19, with 115 deaths so far. There's a 3-week lockdown announced by the government, and our offices are closed. All our staff are working from home. We are in touch on a daily basis through video conferencing, on Skype, and on telephone. The teams are working from home on various aspects, especially keeping in touch with our communities, with the wheelchair users who are spread across the length and breadth of India, especially those who are in remote rural areas. The teams are working with them, they are in touch with them over telephone, trying to get a sense of the ground situation in their regions, giving them support in terms of prevention, giving them support in terms of counseling, support in terms of keeping their wheelchairs sanitized, and so on. The team is working on an emergency appeal to raise funds to support our wheelchair users and their families, many of whom are from very poor economic background. Because of the pandemic, many of the wheelchair users have lost their jobs, or the families on whom they were dependent have lost their jobs, and the situation is quite grim in terms of daily basic essentials. People with disabilities are one of the most vulnerable people whenever a calamity strikes or a crisis situation like this arises. They are often found as one of the last priorities when it comes to emergency response. It could be response and support from the government, and also it could be support from the community and the families itself. We take this very seriously, and we're trying to partner with as many organizations as possible, both government as well as non-government. We are already in touch with a lot of our partner organizations that are working on the ground, coordinating with them to support our wheelchair users. Right now we are focusing on remote support for our users. We are gearing up to start a full-fledged tele-rehab service, wherein we would be offering support via phone calls to our users on a range of topics, which would include immediate protection and safety, support in terms of preventing infection, maintenance and upkeep of their wheelchairs, and counseling support to maintain proper mental health. We are also working on, as I said earlier, emergency support in terms of daily essentials for wheelchair users and families who are from a poor economic background. We've already started to think the direction in which we're going to work once the pandemic recedes. But at this point in time, the key and the most important element is emergency relief and support to the affected wheelchair users. Motivation India as an organization, and Motivation globally as an organization, we are working together, and we'll do all it takes to make sure that our users, the communities we work with, are supported in this time of crisis. Our appeal to you is to help us in our mission. We know each and everyone is affected by this pandemic. But we want to let you know that there are people, disabled people, wheelchair users in remote parts, in rural areas, in villages, who do not have access to information, who do not have access to support, who do not have access to medical supplies, who do not have access to daily essentials. And these are the people who are the most vulnerable, who need our help and support. Thank you.